Wright is a gynaecologist and fertility specialist who completed her undergraduate medical degree with honours at Monash University and obtained her Royal Australian and New Zealand College of Obstetricians and Gynaecologists Fellowship in 2013. Dr. Wright then completed a Master's of Reproductive Medicine and a certificate in Women's Integrative Medicine. Peta is deeply committed to all aspects of women's healthcare and founded Vera Women's Wellness in 2020. She strives to take a holistic approach to managing the health concerns of women of all ages, and Peta has a particular interest and expertise in the areas of paediatric and adolescent gynecology. Dr. Wright penned the recent publication, Healing Pelvic Pain. Given that 1 in 5 Australian women experience persistent pelvic discomfort, this resource is essential. It further explores the connection between this condition and trauma-related physical signs. Welcome to Pure Health Hub, Peta.
Thank you very much for having me.
Pleasure indeed. Now, as you know, a young woman, I was one of those ones, one of the 1 in 5 who suffered terribly from period pain. But, you know, the senior members and women in our family were just all very blasé about it. And obviously they didn't suffer terribly much. And it was almost denied that it existed. Just take some pain relief, and doctors were the same, take some pain relief, get on with it. But what really floored me about this is while this might not assist me now, there's 1 in 5 women suffering. So I am thrilled to share more about this debilitating condition and the ways around it. Now, Dr. Wright, can you tell us about the moment or experience that inspired you to focus on pelvic pain in women and ultimately to pen Healing Pelvic Pain?
Well, the thing is, I just kept getting referred women who had persistent pain, generally who had all of the treatments that doctors had recommended. So they'd often had surgery for endometriosis. They'd had, been on hormonal contraceptive drugs like the pill or other hormonal things to turn off their cycles and turn off their periods. And yet they were still in pain. And a lot of these women would come to me, after having as many as, 8, 10 laparoscopies or surgeries to remove endometriosis. So if we're thinking about, early prompt treatment of endometriosis, they're having that, but yet they still have pain. And often they would land in my office saying, I feel broken. I have no sense of empowerment or control over my own health or my own body. All of the decisions regarding treatment options were kind of made by someone else, not them. They were often unaware that they had options, and most of them laboring under the false belief that if they have had endometriosis or if they have pelvic pain, then this is a lifelong chronic condition that they're stuck with, and they're unlucky to have been born into this body, which is really terrible. And I found, I'm a gynecologist. I was trained basically to treat pelvic pain and period pain with the pill, with surgery. And I wish that surgery alone and the pill alone was enough. But I was finding in my practice, especially when I started in private practice and I saw my patients for follow-up, that actually wasn't enough. And they still often had distressing pain and distressing symptoms. So I started to listen more. I would spend more time with my patients, and I would start to try to understand all of the things that might have been contributing to their particular pain story. And more often than not, I find that it's not just, if we just look in the pelvis, we're never going to get to the root of the issue. A woman comes in to see me. She's not just a uterus and a pair of ovaries and a vagina. She is a complex being with a nervous system, with an immune system, with gut, with all of those things, and a history and an environment in which she exists. So it's impossible to separate a woman from all of that. And all of that contributes to that woman's experience in the world and whether or not she experiences distressing pain, whether or not she has endometriosis. So that's what led me to this, because, you know, it was kind of like a pulling the rug out from under me professionally. You know, I'd been trained to do this surgery, and to realize that it didn't, sometimes it helps, but it doesn't help nearly as much as we're led to believe and that women are led to believe. And oftentimes, especially when women are just chasing that endometriosis lesion, in the pursuit of that, multiple surgeries often leads to more harm than good. And we're obviously leaving out all of the other things that are contributing. So that's where my passion
wow. You know, it's extraordinary, isn't it? Because, you know, it's only, you know, people like you, you know, that I guess when I came into Pure Health Hub and I created it, there was a lot of talk about pelvic pain, and I've interviewed, you know, various professors and medical researchers and things like that. But it often leads down these paths of multiple surgeries. And as you say, the lack of empowerment, the potential damage, you know, those sorts of things. So, well, good for you. We're needing more like you. So noted in your book, an astounding 1 in 5 women, as I said earlier, suffer with chronic pelvic pain. So what are the conditions associated with that? You mentioned endometriosis, obviously periods. Is there anything else?
Yeah, so I think the thing is to take a broader step back and look at why women in particular, like men have pelvic pain too, but why do women have more pelvic pain? And I think firstly is taking that step back and realizing there's a lot of stuff going on in the pelvises of women that doesn't go on in the pelvises of men. So from puberty, women will, you know, we have our ovaries and we have our uterus, and we start to ovulate, and ovulation itself, so the release of that egg, is it's basically an inflammatory event that happens in our pelvis. We make these little chemicals called prostaglandins, which allow ovulation to take place. When the egg pops out of the follicle in the ovary, some of the fluid around the egg can irritate the inside of the pelvis. So it's a potentially painful event. Some women might not notice it at all. Other women might notice some discomfort, and other women find that they have really significant pain there. The same is true when it comes to periods. When we get to that period time, our hormone levels are falling, our endometrium starts to make that same prostaglandin, that inflammatory chemical, to allow the lining of the uterus to shed. Without that, we couldn't ovulate, we couldn't menstruate, we couldn't start the cycle all over again. And the other things that happen when we menstruate, obviously the muscle wall of the uterus can contract, and that can cause discomfort. If periods are heavy, the more inflammation we have causes more pain. And sometimes the opening of the cervix as the blood comes out can also contribute to that. And those prostaglandin chemicals can have effects on other parts of the body, like more nausea or diarrhea or bowel discomfort and other things. So I think it's firstly really important to put into the context the bodies that women are in. We have twice a month the potential for a sensitizing painful event, but that doesn't mean every woman who has a period and ovulates doesn't have crippling pain, right? So I think it's important that we understand that we have these times in our month that do potentially have that sensitizing pain, sensitizing event, and things that can increase inflammation in our body or increase our nervous system, which is really important. The sense of danger in our nervous system means that we're more likely to experience more pain when those things happen, if that makes sense.
Yes, that makes total sense.
So periods themselves can be painful, especially if you're in a body where you don't feel safe and you've got a lot of fear associated with that. So like lack of knowledge, lack of education, lack of support for women in the world who are menstruating. And then you add on top of that the stress of, you know, schoolwork and like never having any downtime and like having children. And when we give birth, that's another thing that's going on in our body, can potentially causing another pain sensitizing event. And then we add in being a woman in the world. And unfortunately, the incidence of, like, even just taking into account the fact that the society doesn't actually cater for women, it's like you just have to pretend you don't have a uterus. You don't have to pretend you don't have that, because you just have to do everything and pretend it's not happening. That creates a huge amount of stress. Apart from that, unfortunately, it's also incredibly common that women and young girls actually are the victims of things like sexual assault, sexual trauma, things like that, which are very common in the population of women I see. Not everybody, and it's not always sexual trauma, but it's often things that have pushed their nervous system up into those survival states of fight, flight, or freeze, where our body is constantly detecting danger. And if our body is constantly detecting danger, it is always going to produce more pain. So a potentially painful sensation, like a period or ovulation, is going to be much more painful. It's like the warning system in the body of someone who's in a survival nervous system state, and this is the link to trauma, is turned up to like 100, rather than, it's safe, it's okay. So they're more likely to experience those symptoms. So it might be just that they've got their nervous system is in that dysregulated fight or flight state. It might be related or stemming from previous or ongoing trauma. It may be an endometriosis, although endometriosis is a complex one. And I think my book is trying to talk about that, because I think in the media, rightly, there's been a lot more talk about endometriosis, which is great, but on one hand, but on the other hand, it seems like it's the only thing that is being pushed out there as a cause for pain. And there's a lot of fear around endometriosis, and I think a lot of misconceptions about endometriosis too, because as I've said, like just focusing on that often doesn't help. And a lot of women who have endometriosis don't have pain, and a lot of women who have identical pain symptoms to someone who we might just attribute to endometriosis has no endometriosis. So like, I think the stats are about 30 to 50% of women with pelvic pain who undergo a diagnostic laparoscopy to look for endo actually don't have endometriosis. So the conversation about pain and endo, if we're just going to focus on endo and surgery, we're missing that huge amount of women, and they're left feeling like, well, what about us? And then there's the group of women I see who've had all the surgeries, had all the endometriosis treatment, and yet they still have pain. So it's less about that.
Wow. I think, and yet you say, that endo may present in, I don't know, let's say 40% of women who are suffering the pain. And so this is this cycle of, well, we've tried everything, so you're just going to have to live with it now, right? So you seem to be one of the few who really wants to take a holistic approach to this and look further and deeper into why and how. And it makes sense, right? We know that when the parasympathetic is struggling, then we know that impacts everything else in our bodies. So that totally makes sense. And I think the fact that you've delved deep into that, and I think you've almost answered the next question. So I was going to say that, so I'll reword it. So the predominant solutions that are surgery and pain relief medication, and yet you emphasize the link between trauma and these conditions. Is there anything more you want to say about that trauma, or what kind of trauma-focused therapy or other effective solutions could women be utilizing?
I think there's a couple of things I want to say about that. First of all, in a bid for women to feel taken seriously or validated, right? We live in this world where the only things that are shown are validated is like a biological thing that we can point to with a camera and go, that's there, we're removing it. You've got this, and you're validated in your pain. Who have pain should be validated whether or not they have endometriosis or whether or not you can see a lesion. So that's one thing. And I think sometimes, I know that probably one of the criticisms I might get for this book, I don't know if I'm jumping ahead of this, but trying to get ahead of it, but is that I'm saying, well, this is like a in your head about trauma thing.
Yes.
And my point with this book is that there is no separation between your nervous system and your physical body, and fear and danger, which is felt in our nervous system. And it can be from big traumatic things, like we talked about sexual abuse, and we know that sexual trauma is much more prevalent in women with persistent pelvic pain. But there can be other things. It can be anything that, like disrupted attachment in childhood. It can be bullying at school. It can be anything basically that drives your nervous system from one of safety to one of constantly being on the lookout for danger, that hypervigilance. which happens in the external environment, but it also happens internally. So that's that internal danger system, every sensation is turned up. So we know that people who have a dysregulated nervous system, who might have had any of those traumatic things happen, could be a single thing, could be complex trauma, so which is harder to kind of identify for many people, but that not feeling like they have someone who's there for them is a really big one. And the earlier it happens, some people might not even have a memory of it, but that has been shown to actually really leave an imprint on the nervous system. So I think it's really important. And also some people can have traumatic things happen and not carry the residual trauma in their bodies, and they've been able to move past it. And I think the other important thing is that it's normal for our nervous systems to go into fight, flight, freeze when we perceive danger. And it's our body's way of protecting us. And that is amazing and incredible. But the problem is only when we get stuck there. And we live in a culture that does not speak this language. And when we're so disconnected from our bodies, we're often not in our bodies.
Yeah.
So I think that also perpetuates it. But when women can start to understand that if they're in this fight or flight nervous system, our digestion is slowed, our immune system is affected, we're more likely to have like leaky gut, which can lead to, one of the theories even of endometriosis is that can lead to this bacterial cell wall, LPS, that goes through the gut wall, interacts with our nervous system, interacts with this marker called toll-like receptor 4, which is this cell that goes between our immune system and our nervous system, which then creates neuroinflammation and has been seen in women with chronic pain, whether or not they have endometriosis. So, so what I try to get across in the book, and I hope I get it across, is that it's not a matter of mind or body. The nervous system is the bridge, and our environment and fear in our environment alchemize in our body to cause physical changes in our body. And we know this from so many studies. And I think one of the things that I found kind of heartbreaking when I was researching this book was that some of this research is like 30 years old on developmental trauma and the link to adult physical disease. And I wasn't taught any of it.
It's amazing. It's amazing.
And then I remember reading a paper from a doctor who was reviewing the paper and saying, with all this evidence, it's absolutely terrible that people who have undergone trauma and are now suffering with their physical health later then have to have further layering of trauma of the medical system, just start trying to fix this one thing, and completely ignoring the effect of the nervous system, which is what I see all the time.
Well, it's so true, right? I mean, you just hit the nail on the head. We're constantly in and out these revolving doors of doctors trying to find answers. Oh my God, and it's so frustrating. And I feel like you've just explained my whole existence, right? A lot of trauma, massive trauma, anyways, but ignored the physical elements, trying to survive through life as we do, until you get to this certain point, which is why it's my mission to remind women that we've got to take care of ourselves long before we hit the 50 mark, and look at those traumas and things. But the fact that is put together and we become more hypersensitive to pain, I think is really what, is what you're saying, is just makes perfect sense. Wow. All right. So tell me then, for our readers, now just sort of closing off the book a little bit, but for our readers who might be experiencing this pelvic pain, and we know it's a lot, or know someone who does, what are some of the immediate takeaways or strategies from your book that they can implement?
I would first of all say, if you're experiencing persistent pain, so that means pain that is experienced like every period cycle or most days for a greater than 3-month period, it's really important, first of all, not to panic. Most of the time, chronic pain isn't caused by ongoing tissue damage, but of course, it's important to seek help and have other things ruled out. And my advice would be to seek help early. And I think why that's so important is that we know from neuroscience that the longer that people are exposed to painful stimuli, the more likely they are to develop chronic pain. Now, when I say they should seek prompt help of their pain, treatment of their pain, that treatment I don't think, and there's a lot of messaging at the moment about period pain, that it should always involve a diagnostic laparoscopy and early diagnosis of endometriosis. I don't actually believe that to be true, because we have a tsunami of women who would be having a laparoscopy, which is probably not going to help, or has a 1 in 2 chance of helping their pain, but is it not addressing anything else? So if you have pain, you get help early, you get investigated early. That might be, if you're someone who's menstruating, a really high resolution, good quality ultrasound scan, or an MRI if you're not sexually active. And those two things are actually very good at diagnosing deep endometriosis, which is the kind of endometriosis which is the most likely to respond to surgery. So if you have a scan which shows that you don't have that, you might have superficial endo, which is probably represents 80% of women with endo. You're less likely to respond well to surgery. And, there's a lot of evidence that endometriosis can go away by itself, especially when you deal with the nervous system. And I'll come back to that in a second. Right. So I would say prompt treatment, early ultrasound, pain education and understanding of how the body works, how pain is triggered and how it persists. There are hormonal drugs that can help for some women, but a good explanation of the pros, the cons. There are lots of non-hormonal things, so movement, pelvic floor physiotherapy, because often there is pelvic floor tightness and tension in the pelvis that contributes. And then looking at the nervous system and digging down to the potential roots of your pain. So if you're always feeling like this sense of danger, you're always going to have pain. Pain is going to persist. So working with a pelvic floor physio, sometimes with a therapist who is experienced in somatic therapy, which is like not just the talk therapy or CBT, which can be helpful, but about dealing with the effects of trauma in the body is really important. And I find that to be very helpful. The study I just wanted to quickly mention, I was at a conference recently, and the man who spoke before me was like the ex-head of endometriosis, the World Endometriosis Society. And I was like, oh God, okay, I have to follow this up. But he was a very clever man and was presenting some really interesting research, but his whole experience is just in research with rats. Like, he doesn't actually see humans or women sit with them.
Right.
But what I got out of his presentation was that his whole thing is inducing endometriosis lesions in rats. And then they did some experiments, which I think is so interesting. So they put some of the rats in a cage with a cat, so like fearful, dangerous situation, fight or flight. And they found that when they measured those endometriosis lesions, they were bigger, and they also displayed greater pain behaviors. When they took out the vagus nerve, so that's the nerves that come down the side of our neck, and that activates our parasympathetic nervous system, so our rest and digest and our feeling safe part of our nervous system. When they took those nerves away so that the rats were always in sympathetic fight or flight, their lesions got bigger and their pain behaviors got worse. Wow. And when they put the mice into a beautiful, enriched environment with lots of wheels to run on and happy things and lots of food and all of that, they found that, so that's mimicking a situation where our cortisol is lower, they found that, surprise, surprise, the endo lesions were smaller and the pain behaviors were less. So I think that's why it is so important to get us into a state where we can feel safe in our bodies, or be able to recognize when we are dysregulated and return to that safe state. And that can help with pain flares and long-term management of pain.
Oh, wow. Absolutely. And I think, I've learned a lot about the parasympathetic and trying to, teach, learn best ways to get back there. But I think it's so important for all of us in terms of our holistic health. It's extraordinary. And we talked about this beforehand, but, Pure Health Hub's philosophy is own your own health journey. So taking that into consideration, what you were just saying, how important is it for women to take leadership of their own health?
It's incredibly important, but often what's heartbreaking is that this is a population of women who have had the control taken from them almost. Like, they've had this external locus of control, like, I've got pain and I can't do anything, and the doctor can't do anything except I have to go on the pill or I have to be on a waiting list for 3 years for surgery. Everything is outside of them. And while surgery, I will say, may be beneficial for some women, even if it is beneficial, there are all these other bits of the puzzle, the nervous system, the pelvic floor, the gut, the immune system. It's like, even if surgery, you will be one of those people where it will be beneficial. It's still like cutting the tip off an iceberg, and you've got the rest of the iceberg underneath there. So it will rarely be enough. But what's amazing is that when you understand how your body works, when you understand that your fear reduces, you have an action plan, you have a toolkit that you can implement, that you're in control of, that gives you your power back. And that is incredibly important, because as women just feel I'm broken, I can't do anything, I have to wait for someone to fix me or do a surgery, that just exacerbates everything. And it's totally untrue. We have a lot of power, and there are a lot of things that women can do already now.
But such as, what can they be doing to get themselves back into
First of all, understanding that some period pain can be normal, or discomfort can be normal. More than 90% of women in surveys will say that. Actually nurturing themselves during their period. So actually, and this goes against the grain with our society. And like, I know that a lot of people will say it's a problem when there's lost productivity and people can't go to work. But I say, well, why not? Why can't a woman have a day at home or work from home, or be in an environment where she's not stressed out and she's able to take care of her body while that inflammatory thing is happening? And I actually think that would be a way where we're changing society and not just expecting women to fit into society.
Yeah.
And then it takes away a lot of the fear and a lot of the stress, and hence then a lot of the pain. I think that's really important. I think using medications and herbs and foods that can reduce prostaglandins, or those inflammatory chemicals. So eating an anti-inflammatory style diet with lots of fiber, lots of good fats is really important to nurture the gut microbiome, which will hopefully lead to less leaky gut and less immune dysregulation. Having some supplements can be helpful, like a fish oil, which is an anti-prostaglandin. Magnesium and zinc are also anti-inflammatory and have shown to be helpful. Ginger root capsules have been shown to be as effective as Nurofen in trials, but have less of an impact on the gut, and also can help with nausea. Using curcumin or turmeric when you're doing your cooking, and ginger, because they're really potent anti-inflammatories. Keeping on moving. One thing that's a really common thing is when people get pain and all of a sudden they get the pain, if they're not sure about what's causing it, the cortisol spikes, they go into danger zone in an already dysregulated nervous system. They'll double over, get into bed, stay there for 2 days. And what's happening in that situation is that the brain is often saying, oh my God, this is terrible. Am I ever going to get out of this pain? And is this going to be my life forever? Or I want this pain to go away. And that says there's danger. And if the body thinks there's danger, it's always going to make more pain, because pain is a danger signal. So we're getting this top down processing, telling our body, yes, you have a reason. Then what's really interesting is we get this bottom up. So we think about the way we hold our body, the contraction of the pelvic floor muscles, immobilization, all of that. And this is really interesting about the vagus nerves. 80% of the messages from the vagus nerve are from the body to the brain. So although that posturing, also not breathing shallowly, not letting your diaphragm drop, which is a direct correlation to your pelvic floor, that says to your brain, even if your brain has got the message of actually it's safe, it's okay, nothing bad's happening, your body's telling a different story, and that will reinforce that message of danger, and the brain will perpetuate pain. Wow. So even simple things like deep breathing, resting, yes, but don't immobilize. So take it easy, do some yoga stretches. There's a lot of resources in my book about different websites that have got like some great stretches to relax the pelvic floor. So pelvicpain.org.au have got a great array of exercises. Doing things that calm your nervous system, like having some essential oils, playing some really nice music while you're moving gently, getting into nature, lying under a tree, going for a gentle walk. all of those things bring you back into that vagal nervous system. And if you still need hormones or anything else to help, they're there. We've got a whole collection of things that we can help. But the key point is you should be feeling in control. And like when you go and see a healthcare practitioner, you've got an array of options. You have them all, pros and cons, spelt out to you, and you get to choose what fits for you, because it's not a one size fits all approach.
No, which is actually what then leads me to the next point. You know, one of the other reasons I started Pure Health Hub was because I was having a whole bunch of issues when I turned, you know, when I was over 50 or 55 actually, and I was struggling to find the information that I needed to be able to educate myself, right? And then what I also discovered was the fact that the reason that women are often left out is we are literally left out of the medical research field because we're a very complex breed. So I was reading in your book, and I love this because I want to address it, misogyny in medicine. Now, you say here, I believe that as a society, we make men the standard, while women, and all the ways we deviate from linear masculinity through our menstrual cycle, which by definition is nonlinear, are treated as abnormal or pathological, diseased. Then you go on to say, I totally reject this paradigm of pathologization that plagues most conditions in gynecology. More often than not, the suffering that women experience comes from a lack of education among doctors and patients alike about what's normal, the pressure to conform or fit into a society that makes it difficult to nurture a female body, the normal physiological response of the body to its environment, the detrimental effects of a dangerous environment on a woman's body, or significant trauma. In most cases, it's the society that's pathological, not the woman's body. Bravo. And I think, you know, this is exactly what we're dealing with here. You know, there's been such a lack of knowledge, but also a lack of wanting to learn more about women's, you know, body, essentially, that we now, you know, we're finding ourselves here. We're really at the start of learning about women's physiology, biology, psychology, and how all of those come together. So I was going to ask you, so addressing the misogyny in the room, I understand that the federal government has announced an inquiry into the misogyny of medicine, but where do you sit on this? You obviously have a strong, you know, you've got a strong opinion about what it is. Can you give me a little bit more about how you feel about it, and also perhaps where you'd like to see women's health in particular in this sort of angle, in this pelvic pain area, once this misogyny in medicine is sort of dealt with, and where you'd like to see us land on an equal kind of footing. Can you tell me a little bit more about that, if I wasn't too convoluted?
No, I think it's very complex, and it's not just medicine. I mean, medicine's part of society, and it's historical. Like, this patriarchal society that we live in is historical. So I guess if you think back historically, before Western medicine, the healers were often women. The midwives, the healers, the herbalists, they were often women, or energy workers, shamans. Like, if we're wanting to extend throughout the whole of the world, they were women. And there was a time period when the church came in, and women were really demonized, and then there were the witch hunts and all of that. And then women were no longer admitted to medical school, and men and male medicine became the standard. And it was, I think the thing is that because we come from this, and then we think about disease, health being the absence of disease, not just like total well-being. And so there's this whole sort of philosophy of, you just remove the disease bit and then the person should be healthy. And it doesn't take into account, when women healers were literally killed and pushed out, that sense of like the completeness of a being, including the spirit and the mind and the physicality being one, went out with that. And so I think the thing is that now we're in this, I think when we talk about the misogyny of medicine in the government inquiry, it's like, well, why aren't women getting more medical things done almost? Like it's this, well, why aren't there more operations? And there shouldn't be more operations, but it should be. Why aren't we looking at this as a whole? And I think women have really outsourced their menstrual cycle, knowledge of that, their body, everything to the doctor. So, you know, women will come in to me wanting to have a baby. They'll have no idea. They'll tell me when they're ovulating because the app tells them. They will have no idea about the other things that are happening in their bodies. And the information that they do have, none of it's positive. It's just don't get pregnant, don't get an STD. Your periods are painful and horrible. Endometriosis is something to fear. Having a baby is horrible and fraught with danger, and it's all awful. The messages are pretty awful and negative, right? It's very fearful, and like no wonder.
Not in the East, though. This is
exactly.
a Western medicine thing. Not in the East. It's not like that at all.
Of course, because and you're coming at it from a menopause perspective too. Yeah. We're here. It's the worst thing in the world to be menopausal because, like, we are obsessed with youth. So it's. I think it's a not just medicine, but it's a whole society thing. And I think for all humans, we need to start to be taking control of our own health rather than waiting to figure out what a doctor says about our health or what we should be advised to do or what they can tell us about us. I mean, the stories I've heard about women who I've seen who have had, you know, who might have gone to the doctor because someone had said, oh, your sister's got endometriosis. You should get checked by this doctor. She has no symptoms. Goes to this doctor, gets an operation, an invasive surgery to find that she has endometriosis where she has no symptoms from. Then gets told that she needs to be on a suppressive hormone, like synthetic hormone to suppress her cycles so that the endometriosis doesn't come back. Then has a whole host of side effects, you know, weight gain and acne and depression, and then get put on weight loss drugs and antidepressants and have surgery after surgery after surgery when they had no problem before, but they're outsourcing their health to like an authority that says, well, this thing is bad and we need to treat that, not we need to treat you. This whole person that is in front of me. And I think the more women start to understand as well, like with our cycles, it's not just a period and no period. It's the way our hormones ebb and flow throughout the month, how that affects our brain, like that's only just starting to become known. Women have had the pill for 50 years and we're only starting to talk about how that actually affects the development of brain. And it's insane, you know, and so what I would love to see is women to almost like go back to that old way of knowing. And like when I talk about teaching women about this stuff, I don't even think about it as teaching them this new information. I actually think women know this in our bones, but we just need to learn how to remember it. And I think, and nurture ourselves throughout our cycle, take care of ourselves when we need, don't be apologetic about that. And just be able to be embodied, because I don't think we're able to do that in society.
I think, and I remember, we've just followed the men. So, when I had a child and then, and I had a career before that, and then you have a child and you don't want to, be treated any differently. So you act like a man.
Yes. But because you have to get along, right? And to get, because if you said 20 years ago, well, I'm sorry, I'm like day 27, I'm feeling a bit crunchy, I just need to take some time, they would look at you like you were insane and you wouldn't get your promotion. But now I actually think that's changing. And so like in my workplace, I know I live in a bubble, but we'll say, oh, what day are you? I'm day 21. You need a bit more love. You need a chocolate after lunch.
Oh,
right?
What a nurturing environment.
Yeah. And I think we should be able to be talking about that. Like my stepson, who's 14, could probably draw the menstrual cycle on a graph and he'll go, God, Peter's a bit cross. What day is she? She's 27. I'll stay out of her way. Okay. And I think that's great because it tells us that we have permission to actually own our biology and it doesn't have to be a weakness or a shameful thing.
It's so true. And I think you're right. We handed over the advent of modern medicine. We relinquished our responsibility for our own health I mean, modern medicine has a great place in the world. You're
Yes.
not about bagging that, but we need to own this first.
Mm.
And on that note, I think it's a fabulous book, and I can't wait to finish it. I only picked it up yesterday. But from the post office. But the aim of Healing Pelvic Pain is to deliver a new paradigm for pelvic pain care and empower all women to ask their medical practitioner the right questions and make lifestyle changes to bring release from suffering. So congratulations on this. Well done. I'm sure it will be extremely popular. Where the more we're learning, the more we realize that we need to learn, we need to get more education about our own health. Gee, struggling today with this throat and my brain, it would seem, but maybe I was on old day 27. Thanks, Peter. I really appreciate your time today, and congratulations on this. Well done.
Thank you very much.